Hi everyone. So today we're gonna look at the topic on diagnosis and looking at Chinese medicine diagnosis. So what we wanna ask ourselves, when a patient comes in, what are we really doing? Right? So people will say that diagnosis is like detective work. You find the evidence and the patient comes in with signs and symptoms. You look at it, assess it, and then you find the cause of it. So once the cause is located, then you can give the treatment to fix the problem, fix the cause. However, Chinese medicine diagnosis is actually more complex than that. So what is Chinese medicine diagnosis? So we're gonna look at different concepts today, and the first one you're most probably familiar with is a pattern. So what is a pattern? Well, if you are a Chinese medicine student, you probably learn about patterns, and you probably pop in your mind like, oh, it's like Qi differentiation, heart spleen differentiation. So it's almost like a name of a pattern. It's a pattern, but that's more complex than that. So Chinese medical diagnosis, we have two things. One is we have a pattern. We've had a pattern diagnosis, and we have a disease diagnosis, right? So we have disease as well. So we have disease diagnosis. So we look at both, and the general process is that we, first we first differentiate the disease, and reach the disease diagnosis, and then we, go towards the pattern diagnosis. And for pattern diagnosis, it's basically at multiple levels. So a way you can look at it is like this. So, right, let's say a patient comes in, they complain of, let's say, poor sleep, cannot fall asleep, right? And then usually we have what we call a chief complaint, right? We have a chief complaint. So that could be, basically what the patient is telling you what's happening. And then they'll tell you what feeling, maybe they wake up during nighttime, or they have lots of dreams. So these are all kind of called like symptoms, right? So you'll just draw a person, maybe draw a person. Yeah, so these are all symptoms, right? So cannot fall asleep, not fall asleep, etc. And then you also have signs. So maybe in terms of modern medicine is like high blood pressure, etc. Right? Those are more like objective things that the health official can look at. And for Chinese medicine, we look at like this, right? So if you imagine like I guess like a planet, right? You have longitude and latitude. So longitude is like this, and you can think of this disease, right, as this longitude, and the latitude is the horizontal line, which we call a syndrome. So now we introduce a new name, a syndrome, right? And we have multiple ones, right? So and this dot here is actually called it's a symptom, right? It's a symptom. So like you feel headache, dry mouth, that's a symptom. And this is why, right, in Chinese medicine we say same disease, different treatment. Right? Same disease, different treatment. So what does it mean? So basically the same disease, right? There's still the same line, but we have different treatment. Why? Because we can divide it into different patterns, right? And for each pattern, we have a treatment associated, right? We have a treatment associated, right? And yeah, and then they also could have different symptoms. Also, we also say that, right, a different disease, a different kind of disease, they have the same treatment. Why? Well, because they can probably all belong to the same syndrome, right? So basically, this line still remains the same, but here we are having different disease, right? And then again, they have different symptoms, but they all have the same syndrome, right? So this really shows us that at the heart of pattern differentiation is we're really, it's a really complex way of assessing, right? We look at two layers, one disease and a syndrome. And not only that, we also look at, and these things can change depending on time and depending on position, right? It's in a space. So that's why actually the pattern itself is actually, it's like a multi-layer. It constantly changes, and also it can absorb information from the outside. And then it can continue to change. So when we say, so now we know what is a pattern, but and we also know that we have terminology called pattern differentiation, right? So we call it differentiation. So what are we really differentiating? Well, we're really actually differentiating on multiple layers. So we can differentiate what the evil qi, the zhen qi, we can differentiate the pattern itself, right? Because at the end of the day, right? We trying to find the cause, right? So the pattern itself, it kind of tell us that the cause, right? It's kind of alluding to us the cause of the disease, and which brings us to analyze, what's happening, right? So basically, in Chinese medicine, we have, the two things as cause, right? So we have the positive or the rightness qi, and the evil, right? Evil, and they fight each other. The zhen pathogen, the positive pathogen fight with the evil pathogen, and this process and this outcome, this process and outcome, what they produce, right? They produce symptoms, right? They produce symptoms, right? And when we say when we zhen qi, it's it includes what modern terminology, it's what includes like immune system. Immune, it maybe includes like like immune, like self restore, maybe resistance, right? And self-resolve or self-repair, but better word. Yeah, self-repair. So, right, and then here we have exterior pathogen, 6 exterior pathogen. Yeah, and all the other things like 7 immersion and 6 desire and also like blast phases, yeah, etc. All right, so the outcome, the process and the outcome produce symptoms, and you can generalize the process and outcome in a general sense. That's, well, you can call it that's a pattern, right? That's what the pattern entails. So now you can probably see that, getting a more full picture of what pattern means. Pattern encompasses, it contains the process and outcome of the genchi fighting against the evil pathogen, right? It entails the syndrome, disease, and the interrelationship between them. And so all this encompasses what a pattern means. So why is it important? Why do we need to know about this, right? Well, it's important because when we are really learning about Chinese medicine with diagnosis, right, often the question is, should you just, match like a symptom or like match what we learn on a lecture note to the patient's presentation, and then we say, oh, that's a pattern. Is that really the way we diagnose? That's the question, right? And the answer is no. We don't do that. Because as we said, it's far more complex than that, right? So an example is, in the classical text, 伤寒论, right? About the what we call 小柴胡汤, right? If you have all this, I guess the syndrome or the pattern or the symptoms of it, let's say feeling hot and cold, pain in the ribs, don't want to eat anything. If a patient exactly have this, would you say you just give 小柴胡汤? Probably not. Why? Because, well, first of all, that's not the way of looking at it, right? Because you need to dig out what is the etiology, right? What is the etiology? Because basically what the classical texts tell us is a generalized collection of many different things combined. So it entails a general rule and principle of the outcome and process of zhen qi and evil qi. It entails the possible etiology, entails the symptoms, syndrome, and disease, and the interplay with them. So that's why you have to, dig further. All these patterns, all the symptoms or syndrome, they're giving a clue. And they're giving a clue to dig out the etiology. Right? Because once you found the etiology, then you can come up with the treatment principle. You have the etiology, then you go to treatment, right? And in the classical text, right, you can already see that they have a treatment itself. And here it's almost like a model. It's like a model that where everything all interlocked, where the etiology, the patterns, the process and outcome, zhen qi, evil qi, the symptoms, syndrome, and disease, all interlocked with the treatment itself, right? So when we are diagnosing ourselves, we're not just copying and pasting what the classical text says. That's not what we should do. We should consider all the possibilities. We should think about what this patient presents to me. We need to dig out, their past medical history, and symptoms, And underlying, what they really show, what's the relation between the zhen qi and the evil qi, right? And further, what is possibly the etiology of it? And that's what we're trying to create, right? That's what we're trying to find out. And only when we actually find out this, then we can form a more accurate diagnosis and subsequently more accurate treatment. Right? So really, I'm just want to summarize what we learned today, right? So basically, we look at many different things. So in summary, right? So what is the pattern, right? What is a pattern? Or how should we think about pattern? Well, number one, a pattern is, we can think of this, a pattern is more like holistic. It's a holistic, but it can be more specific view, right? It entails both the science and system, both objective and subjective data. It entails everything of it, right? And it gives you a overarching view of what's going on. Number two, pattern, we can also look at what the zhen versus evil pattern is going, right? What is the process and the outcome? And this tells us what? This tells us the etiology, right? The etiology. Right? And basically that is what we're looking at, right? And if we want to bring an example, right? Let's say, like usually, let's say bladder heat, right? Bladder heat, what is telling us? Well, bladder heat is telling us that, right? It's telling us basically the evil pathogen, right? The evil pathogen, that's what it's telling us. So, and maybe also the relation between evil and zhen qi. And another example is, maybe qi stagnation, maybe chest pain. That's telling us the etiology and also the disease itself. Right, so you can see that the pattern name, it tells so many different things, and really up to us to really uncover like what is actually going. And as we said that, number three, pattern, right? Maybe we'll just change a different pen. A pattern, it changed across some time and space, right? So you need to constantly change and adapt, right? You need to revise, review, reflect, right? And you need to make adjustments, right? Because it's constantly changing with time, position in our space. So I hope you guys found this really useful. Personally, this is something that I really only knew after 4 years of undergraduate in Chinese medicine. And well, I hope really this will be helpful for maybe current students or graduates, even teaching professionals. I hope this really helps you to think about, what are we really doing? What is the pattern? What is the syndrome? And what is going on? What is our aim? And how should we best approach Chinese medicine study? Thanks for watching.